right, thank you very much for joining our interview today. We have a special guest. It was really hard for me to find a medical student who already went through medical school and who is now working as a pediatrician in one of the doctor's office, right? So yeah, could you briefly introduce yourself to the audience?
Hi, my name is Young. I'm currently a pediatrician doing primary care in the Bronx.
Could you like briefly go over, what's the reason why you decided to be in the medical field?
I think as a kid I always liked doing like science, math, so I had an inclination for that field, but I'm I'm a people person, so I really like interacting with people, so medicine is a good way to put all that kind of together, like a way to help people, a way to serve different communities using science, math, people skills, all those kinds of things.
Okay. What were your strategies to navigate through college year to get into the medical school?
Mine was like many years ago now, so it's probably a little different now, the process. But overall, study hard in school, do your best, get good grades. But even if you don't, I mean, it's not game over. Like there's a lot of other ways you can get in. Even people with not the best grades, they have different ways of getting in. Like I also did like research, volunteer activities, especially like medically related volunteer activities or like clubs, things like that. Those are pretty helpful as well. And also like study hard to do well on your like MCAT or any other like tests that might come up. Yeah.
Okay. Is there any strategies on like how to prepare MCAT?
Oof. Everyone does it differently. I did like a summer like a course on like MCAT, like power course or something like that. But some people do just fine even without the course. But I think it really depends on your study style. If you need that structure, like you need actually classes to help you study. Like if you can't like focus on your own, then maybe that'll be good for you, like me.
Oh, gotcha.
Yeah, but I think you just got to give yourself ample time to study, and like you gotta set a schedule for yourself and like kind of just stick to it.
Okay. So I know like to get into medical school, it's not just about getting good grades, right? You also have to have certain clinical hours or volunteer hours that associated with the application. Other than like those, is there anything that could kind of make you as one of the strong candidate to be in the medical school?
Medical schools value seeing students and applicants who have kind of a life outside of just medicine too. Like don't be afraid to put like other clubs, like interests. I was on a dance team or like a gospel choir, things like that. So it really depends, like to show that like you're passionate about something, you're willing to get involved in those kind of things.
Gotcha. A lot of people, when they just hear about being in medical school, they tend to think that it's around 10 years overall process, including the undergrad years, right?
Oh.
What were the years that it took for you to complete your program?
So undergrad is 4 years. If you go straight, so you apply in junior year, you would I can't remember, it's been so long. Well, if you just go straight right after undergrad, it's another 4 years of med school, so it's 8 years of total of just like school. After you graduate med school, you're technically a full doctor. You have your MD license or degree. But then after that, you have to do a residency, which is you're a doctor, but you're still training. And now you're training as a doctor in the hospital, so you're still pretty new to everything, learning a lot. Depending on what specialty you do, the residency length differs. So like pediatrics was only 3, surgery's 5. So it's a big range. But the shortest usually is 3, I believe. And after that, if you want to specialize further, you could do fellowships, and that's more training. So in total, it's at least 10. Including undergrad through residency, at least 10 and probably more, depending on what you want to do. Yeah.
Wow, it's a pretty long process to just go through everything and actually start working as a licensure doctor, right?
Yeah.
Was there anything that you didn't know about, but once you got into medical school, you kind of realized, oh, I wish I knew this before coming into medical school?
Oh man, I can't think of one on the spot. I mean, I think people who go into medical school know and they hear that it's hard.
Yeah.
But I think it's just the type of hard, like you might not have experienced before. Yeah, but don't know. I think it was kind of expected, but like the way it's hard is a little unexpected. So like, yeah, it really, because like I think at least for me it was very humbling, because I'm used to being like one of the smartest ones in the room.
Oh.
And then like you go to and then you go to college and you're like, oh, I'm not the smartest. And you go to med school, it's like, oh, I'm really not the smartest.
Oh, wow.
Yeah, so it's a very humbling process, but I think knowing that like you just got to do your best, learning and studying, and knowing that it's not just for you to be smart, but it's actually like everything you learn is ultimately to help your patients. Yeah.
I guess you can use that as one of the ways that you can always remind yourself the reason why you have to study hard. It's not just about passing and just get done with the medical school, but it's to really help the patient in the best possible way. Yeah, I thought it was pretty interesting to hear about in that aspect. What are some of the ways that you can choose your specialty once you finish your 4 years in medical school?
In medical school, in the third year especially, some schools now do it in second year, but you start doing rotations through different specialties, right? So that way you get to kind of experience what each specialty is like. And I think it's a little subjective because sometimes some people have great experiences on that particular rotation, other people they don't. So I think it could be up to that. Other times you come into med school with already a specialty in mind. I know a lot of students who do, and sometimes they stick with that. Maybe a lot of the times I hear is like, oh, they know a family member or someone who was dealing with certain like illness, so they were very passionate about that particular specialty. But I know some people who come in with a specific specialty in mind, and then they end up switching it midway. So I would cut, if you have one in mind, sure, go after it, but be open-minded because you never know. You might experience something that you like more.
So I guess you can kind of explore in different specialties before you choose the one that. Okay.
Yeah, so there's time to explore before, and if you have to choose around like third year, end of third year around or beginning of fourth year, that's when you apply to residencies. So before that, you should kind of have an idea.
Okay. What is one of the most important lesson you learned after completing your medical school program?
One of the most important. It's deep. a little related to what I said before is staying humble. Because even if you do feel like you know everything, medicine is always like kind of changing, advancing. Stay on top of those things, so you always want to be having an attitude of willing to learn, but also being humble in the sense that sometimes I think doctors can feel a little like prideful or above the patient, right? They feel like they're just treating a patient who is beneath them. That can definitely seep into your mind if you're not careful and you're like actively trying to remind yourself that no, you're there to serve the patient. You're there to really help them, So keep an open mind and stay humble. Yeah.
I thought it was just very important for you to mention that even though you may think that you're in a high position in terms of being in a society, you're still there to help the patient, and staying humble is one of the ways that can really bring the best help for the patient. Yeah, I'm just gonna ask a couple questions regarding to like your undergrad, because I heard you went to Johns Hopkins, right? Could you just briefly explain about what major you took in Johns Hopkins and what were some of the experience that you had in the school?
I did biomedical engineering, so that was rough.
Sounds rough.
Yeah. I did not do too well. I did like good enough to get into med school, like praise God, but other than that, yeah, it was to be honest, it was very rough, and like I think med school was actually like a little bit easier for me than undergrad, just because like the content we were learning, and it doesn't really like matter what kind of major you do. Obviously, it's a little bit easier because you don't have to take extra courses if you do something more like science related, like bio or something like that, to apply to med school. But honestly, I had fellow med students, fellow residents who did like really random majors like English literature and things like that.
Wow.
So you could technically apply into med school from almost anything.
Yeah, it's pretty interesting how you don't really have to have a science specific major to be in medical school. I thought it was pretty cool that English major student, they got into medical school.
Yeah. And I think you just have to take those like supplemental courses to get the required courses in there. So.
Okay. Last question. I think a lot of people, especially for high school students, when it comes to college application, they want to be in one of the prestige school, like in the US. If you were to think about just one thing that is the most important in terms of preparing for a college application process, what do you think is gonna be your recommendation and why?
Don't be anxious. Obviously, it's easier to say for me to say that because I'm on the other side, but I think looking back, I know whether it's for me or a lot of other classmates, getting into a good school, like named school, it can help. It can help to a degree, but then like I've been already talking about like my classmates, there were a lot from like some like community college. But once you get to med school, it's like it's a level playing field, right? They don't really care like where you came from because once you're in, and like I know some of them who are like making like 4 times as much as me now.
Wow.
So like not saying that money's the most important, but like it really just sets the playing field back to zero. So I wouldn't worry too much about what school you get into. Work hard, do your best, get good grades, do all the things that need to be put on your application. And if you keep trying, even if you don't get in the first round of applications, I have several friends who've applied like 2 or 3 times just to get in, because it is getting harder to get into med school every year. But if you really want to be a doctor, you'll find a way.
What are some of the things that you learned as pretty valuable or something pretty unique after having experience in Johns Hopkins?
Does it have to be positive?
No, it doesn't have to be. It doesn't have to be positive. It never. I never tell. Whenever I interview, it doesn't have to be positive.
I think one thing I realized is just because it's a good name school doesn't mean all your classes are going to be well taught. Especially like the bigger lectures. Like sometimes the teachers are not the best at teaching. And like it's kind of up to you to kind of learn. Some of the courses I took, like teachers were great. But some of the classes I was like, why are you a teacher? In terms of positive thing though, I think it's like the experiences and relationships you build during your college years. Like after all the years, like you just kind of remember like the suffering from academic stuff, but then it's like those relationships that last. Have fun. Build good friendships, make memories. But also work hard. Work hard, play hard.
Thank you so much for amazing advice for a lot of high school students, and it's just so much value for many students who are curious about the major, who are curious about the industry, but they don't really have any, people who could give advice to them. And I hope that these content could give information and inform you so that you can get some idea of what it is to be in medical school and what are some of the process that you have to take to be in medical school. So I hope you guys enjoy the content, and once you guys get to our position, you guys can do the same thing, helping other people. So we'll be back. Thank you very much.